Welcome to Fast and Furious MCQ edition. Let's learn about the subject pathology. In pathology, we learn the topic calcification. The calcification is a process of calcium deposition, and it may be in a normal tissue or in a abnormal or a pathological reason. It may be a physiological reason or it may be a pathological reason. And in case of calcification, we have two types of calcification. One is dystrophic calcification and other is metastrophic calcification. Here, from the word dystrophic, the first letter is D, so it signifies dead. D, dead tissue or a dead organ. Dystrophic calcification occurs in the dead tissues and even at the normal serum calcium level. In case of dystrophic calcification, the serum calcium level will be normal, but the calcium tend to deposit in the dead or atrophic tissues. This is called the dystrophic calcification, and some of the examples are in case of atherosclerotic plaque. This is the image showing the blood vessel with the atherosclerotic plaque, and this calcified or the dead blood vessel, we have this calcified calcium deposition, and this is an example of dystrophic calcification. We also have the valves, heart valves, either mitral or aortic valve or tricuspid valve, due to any infective endocarditis or anything or MI, this old age, the calcium deposition occurs in the dead tissues of this valve, and this is called the calcified valves, heart valves. These are the two examples. Moving on to the metastrophic calcification, on the straight opposite side, dystrophic calcification occurs in the dead tissues, whereas metastrophic calcification occurs in the normal tissues. And in case of dystrophic calcification, the calcium serum level is normal, and in case of metastrophic calcification, we have the high serum calcium level, and this is the cause for the deposition of calcium in metastrophic calcification. In metastrophic calcification, even the calcium deposition occurs in the normal tissue because of increased calcium level. So the main pathology is increased calcium, which leads to deposition in the normal tissue. And some of the examples are what are the conditions which leads to the high level of serum calcium or responsible for this metastrophic calcification. And the reasons for this high level of calcium are parathyroid. Parathyroid hormone plays a major role in the calcium. So when parathyroid hormone is higher, serum calcium is also higher. So hyperparathyroidism and parathyroid carcinomas, and eventually the same hypercalcemia, which leads to which indicates there is a high level of calcium, and vitamin D intoxication. These three are involved in the calcium metabolism. So when this get abnormal, the serum calcium will be elevated. And in case of Paget's disease, the bone resorption occurs, which leads to increased serum calcium level. And in case of renal failure, due to hyperparathyroidism and calcium abnormality in the metabolism, it leads to increased serum calcium level. And in case of sarcoidosis, these are the conditions which leads to high level of serum calcium, and which in turn leads to the metastrophic calcification, that is calcium deposition in the normal tissues. These are the examples of metastrophic calcification. Usually in case of metastrophic calcification, the calcium deposition occurs in the lungs or in the kidney. These are the two preferred organs, even in a normal tissue, where this metastrophic calcification occurs.